Hidden signs your creatinine is rising. Most patients miss these. Do you notice small problems that come and go? These small things can point to rising creatinine. Most people never link them to kidney stress. Today we will talk about hidden signals that appear early. I will explain how they start, what they mean, and why you should notice them early. Make sure you watch until number 6 because it is often missed even by patients. And yes, I have a useful bonus tip for you at the end. To help you understand how early kidney stress appears, we will begin with a sign that looks simple but carries important meaning. It shows up in the early hours and can tell you a lot about your filtration health. So let us begin with the first sign called mild morning facial puffiness. Morning puffiness on the face can look normal, yet it often points to early kidney stress. The kidneys control fluid balance in the body. When this balance slows, fluid collects in soft tissues during sleep. This creates puffiness around the eyelids and cheeks. Many people see this change and think it is due to poor sleep. But kidney stress often produces a different type of swelling that fades as the day goes on because the body shifts fluid while you move. Cleveland Clinic has shared that facial swelling can be an early clue in people with rising creatinine. This swelling happens because the kidneys cannot clear sodium well. Sodium pulls water toward it. This increases water in the tissues under the skin. The body tries to move this extra fluid when you wake up and start your day. That is why the puffiness often improves by mid-morning. Cold months play a role too. People often drink less water in November and December. Dry air and indoor heating increase water loss through the skin. Low fluid intake makes the kidneys work harder to keep balance. This extra work slows filtration and pushes more fluid into facial tissues. You might not feel pain at this point. The change is gentle, but it still gives meaningful information. You can tell it is not sleep-related because the swelling feels soft and squishy. Sleep swelling feels firm and improves faster. Kidney-related puffiness stays longer and may come with a dull morning headache. This happens because waste products stay in the blood a little longer than normal. Many people try cold compresses. This reduces swelling for a short time, but does not fix the imbalance. Others eat holiday foods that are high in salt. Soups, deli meats, and casseroles contain large amounts of sodium. These foods pull even more water into the tissues. Seniors often face more confusion since some medicines like calcium channel blockers can also cause swelling. This makes it harder to tell the cause. There are simple steps to support your kidneys. Lower salt intake at night. Too much salt before sleep causes more fluid retention. Drink water earlier in the day instead of drinking most of it late at night. This helps the kidneys filter more during active hours. Add foods like pears or winter lettuce. These foods hydrate the body without stressing the kidneys with heavy minerals or high sugar. Morning puffiness might look small, yet it carries deep meaning. It is often one of the first signs of rising creatinine because the body tries to protect itself long before major symptoms appear. If facial puffiness is the surface clue, the next sign sits deeper inside the body. Many people confuse it with normal aging or cold season stiffness. It can start without warning and feel stronger at night. Now we move into the next sign called unusual muscle cramping and twitching. Before we continue, tell me where you are watching from and what kidney signs you are dealing with right now. If you want to lower creatinine and protect your kidneys, subscribe to Knowhow and turn on the notification bell. And if this helps you, type 1 in the comments or 0 if it does not. Muscle cramps can come without warning. They can appear during rest or light activity. This change often happens when creatinine rises and the kidneys cannot manage minerals well. The kidneys keep the balance of potassium, sodium, and magnesium. A small shift in these minerals can affect how muscles contract. This is why even mild kidney stress can lead to cramps or sudden twitches. Johns Hopkins Medicine has shared that people with early kidney issues often feel cramps at night. This happens because the body slows movement during sleep. Blood flow reduces in the limbs. The muscles then react to tiny mineral shifts much faster. A person may wake up with a tight calf or sudden sharp pain that does not match their activity level. Some people also feel random leg movements when resting in the evening. Cold months can make this worse. Circulation slows in lower temperatures. Muscles need steady blood flow to work well. When the flow decreases, nerves fire more quickly. This creates twitching that feels strange. Have you ever felt a leg jump when you are just sitting quietly? Many people think this is just stress. But rising creatinine can create the same feeling because the muscles do not get balanced mineral support. Some common habits make this problem stronger. Many people drink sports drinks to fix cramps. These drinks contain high sodium. This extra sodium can make kidney stress worse. High protein powders can also raise creatinine because they increase waste from protein breakdown. This adds extra work for the kidneys. People often ignore cramps when they appear with swelling or tiredness. These combined signs often point to early kidney strain. People who take diuretics or medicines for high blood pressure should not change minerals on their own. Minerals can shift too fast with these medicines. Magnesium supplements can also cause problems if taken without guidance. The body only needs a small amount. Too much creates loose stools and lower mineral balance. There are gentle ways to support muscle health. Winter spinach contains natural magnesium and works well in warm meals. Pumpkin seeds also help because they carry healthy fats and steady minerals. Chia adds fiber and minerals when sprinkled on oatmeal. These foods give slow and steady support to muscles without harming the kidneys. Warm baths with Epsom salt relax muscles, but they only calm the feeling. They cannot change mineral balance inside the body. Muscle cramps are easy to blame on age or stress, yet they often appear early in kidney strain because the kidneys manage the minerals that control every muscle movement. If you feel cramps more often than before, how often does this happen for you? Many viewers notice it more during colder months. Your answer can help you see a pattern. If you find this helpful, please like this video. Your click tells YouTube that this message matters and helps Knowhow reach more people who need kidney support. If you think others should learn this too, tap the thumbs up now. Now we continue to a sign that many people call holiday tiredness. It often shows up before lunch and pulls your energy down in a quiet way. I am talking about persistent midday fatigue. Midday fatigue often feels simple, yet it carries serious meaning. The kidneys play a key role in red blood cell production through erythropoietin, so any slowdown affects oxygen flow. When creatinine rises even a little, this hormone process weakens. Lower oxygen movement places more stress on muscles in the brain. This stress often appears after breakfast and stays until mid-afternoon. Many people think this is normal tiredness, but the body is working harder to manage waste. When metabolic waste builds up, the brain must push through heavier pressure. This pressure slows thinking and increases cognitive load. Even small shifts in potassium or sodium can slow nerve signals. These slow signals make the mind heavy and unfocused. Many people describe this as a fog that lingers through the day. This type of tiredness often returns again and again because the kidneys cannot clear waste fast enough. Have you noticed that some days your energy suddenly crashes before lunch for no clear reason? Comment below. I would love to know how often this happens to you. During November and December, this fatigue grows stronger in many people. Lower daylight hours reduce movement, and less movement slows blood flow. Slow blood flow forces the kidneys to push harder to move waste. Many holiday drinks like cocoa mixes and flavored lattes contain added phosphorus. Phosphorus additives raise kidney load and increase tiredness. These drinks may look harmless, yet they add steady pressure on kidney filters. People often make simple mistakes when this fatigue builds. Some drink extra caffeine to push through the day. This only hides the sign while raising dehydration risk. Others think it is iron deficiency without checking kidney markers. Low iron can cause tiredness, yet kidney strain often comes first. This delay can keep kidneys under pressure for months. Simple habits can support better energy. Warm herbal drinks like ginger tea or peppermint tea hydrate without sugar. These drinks help the kidneys remove waste with less stress. Cooked Swiss chard or small servings of raisins can support iron levels if guided by a provider. Slow morning stretching can move blood and reduce waste buildup. Light walks during early daylight also help the body clear morning fluid. Fatigue signals internal imbalance, but the next sign shows up on your skin. It can feel dry, itchy, and often gets blamed on winter air. This sign can start early and last for weeks when creatinine rises. Now we shift to the next area called itchy or dry skin patches. Dry or itchy skin can be an early sign of rising creatinine. The kidneys filter phosphorus, so rising phosphorus stays in the skin when filtering slows. Extra phosphorus pulls moisture away from the surface. This creates dryness and irritation, even when a person drinks enough water. Metabolic waste also reduces oil gland activity. Lower oil levels leave skin unprotected, so the surface becomes rough on arms, legs, or the back. These areas show changes first because the skin there is thinner. Dermatology units at Mayo Clinic note that this dryness appears early in many kidney patients. Their teams see flaky patches that do not improve with lotion. This dryness appears deeper than winter air effects. It lingers for days because the kidneys cannot remove waste well. Many people think this is normal, seasonal dryness, but the skin reacts to chemical changes inside the body. This type of dryness does not behave like simple winter skin. Moisturizer may help for a short time, but the itch returns soon. The skin may look dusty or slightly white as cells lose moisture. Warm showers tend to make the itch worse. Long warm showers pull more moisture from the skin and open tiny vessels. These vessels then release more heat and make dryness feel stronger. Many people use scented lotions that contain alcohol. These lotions irritate weak skin barriers and increase redness. Some also use strong scrubs to remove flakes. Scrubs make the surface more fragile when the issue is deeper. Processed cheeses or packaged meats contain high phosphorus levels. Eating these foods often increases skin dryness because the kidneys cannot clear the extra phosphorus well. Certain foods can support the skin while reducing kidney pressure. Ground flaxseed contains omega-3 fats that support cell moisture. Canned salmon or walnuts also support healthy oils in the skin. A humidifier can help during evenings by keeping room air moist. Moist air reduces water loss from the skin surface. Gentle cleansing with warm, not hot, water protects the skin barrier. Now we'll talk about a sign people almost never connect to kidney strain. This next clue comes from a daily habit that many people overlook. It can change slowly, yet it gives very clear information. Now we move forward to changes in urine appearance and odor. Urine changes often give early clues about rising creatinine. The kidneys control water and waste balance, so any slowdown changes how urine looks and smells. When filtration slows, creatinine levels rise in the urine. This rise changes color because waste becomes more concentrated. Darker shades suggest that the kidneys are working harder to handle fluid. Foaming can appear because extra protein leaks into the urine when kidney filters weaken. A stronger smell may also appear because waste stays longer in the bladder. Experts at Stanford Medicine report that foamy urine often signals early protein leakage. This early leakage can begin before pain or swelling. Many people see the foam but think it is normal. Some people also notice cloudiness that appears suddenly. Cloudy urine can signal infection because microbes change the fluid. Tea-colored urine may point to dehydration when the kidneys cannot clear waste smoothly. Pale yellow is usually normal because it shows balanced filtration. Holiday meals can place more strain on kidney filters. Salt-heavy foods pull water out of tissues and push urine to become darker. Salty meals also force the kidneys to work harder to move sodium. Low water intake during cold weather adds more pressure. Many people drink less in cold months, which thickens blood and slows kidney flow. Slow flow creates a backlog of waste that deepens urine color. Thick urine also carries stronger odor because waste becomes more concentrated. Many people mix up urine changes with vitamin use. Certain vitamins can darken urine, yet the effect is short. Dark urine that stays throughout the day suggests poor hydration or kidney strain. Some people ignore foaming because they have seen it before. Foaming that appears most days can point to ongoing protein loss. This loss means the kidney filter is weakening. Simple habits can help people understand their hydration status. Checking urine color at midday shows if the kidneys are clearing waste well. Low-sodium soups and broths can support fluid balance without overworking the kidneys. Water-rich fruits like apples, grapes, or mandarins add gentle hydration. Eating these fruits earlier in the day reduces evening pressure on the kidneys. We have looked at visible signs, but the next clue hides in your circulation. It often appears during a routine health check when people least expect it. Now we will talk about sudden blood pressure fluctuations. Blood pressure changes can be one of the strongest signs of kidney strain. The kidneys control water movement and sodium balance, so any slowdown changes blood flow. When the kidneys cannot move fluid well, fluid builds in the blood. This buildup increases pressure in the arteries and creates sharp rises. Waste buildup also affects blood vessel walls. These walls stiffen when waste stays too long. Stiff vessels cannot relax well, so pressure goes up and down without warning. Research from Harvard-affiliated specialists shows that unstable pressure can predict early kidney decline. They found that morning pressure spikes often come from poor overnight filtration. When filtration slows, water collects in the blood instead of leaving through urine. This creates strong force in the arteries after waking. Some people feel a pounding in the head because vessels stretch quickly. Others feel dizzy when standing because pressure drops fast due to vessel weakness. Have you felt a sudden head rush when standing up after resting? Many people make simple mistakes when they see changing numbers. Some take extra pressure medicine without guidance. This can drop pressure too low and weaken blood flow to the kidneys. Some eat large holiday meals filled with salt. Salt pulls more water into the bloodstream and increases pressure swings. These swings wear down vessel walls and increase kidney stress. Many people wait months before checking pressure again, which hides early changes. Balanced habits can help steady blood pressure. Foods with potassium like winter squash, bananas or oranges support sodium balance. Potassium helps relax vessel walls when guided correctly. People should check pressure at the same time each day. This helps show true patterns. Processed foods should stay low because they contain hidden salt that stresses the kidneys. Gentle walks increase blood movement and reduce pressure buildup. Slow breathing during stress can also relax vessels and lower sudden spikes. Now we move into the bonus section. This final part explains a simple daily food habit that helps the kidneys handle waste and fluid with less effort. It is easy to apply, works quietly in the background, and supports healthier creatinine levels over time. Get ready for the evening kidney-friendly meal habit. A kidney-friendly evening meal can make a bigger difference than most people realize. During nighttime hours, the kidneys work steadily to filter waste while the body rests. What you eat at dinner, and especially what you avoid, can reduce overnight kidney pressure. A balanced evening meal with low sodium, moderate protein, and hydrating foods allows the kidneys to move waste smoothly. Heavy or salty dinners pull water into the bloodstream and force the kidneys to work harder. When this pressure continues, creatinine rises because the filtration rate slows. Choosing lighter foods helps the kidneys slow down gently during the night. Vegetables such as steamed zucchini, cauliflower, or yellow squash offer hydration without loading the kidneys with minerals that may cause strain. Small portions of white fish or lentils provide steady protein without overwhelming the filtration system. Herbs such as parsley or dill add flavor without adding sodium. The timing of the meal matters as well. Eating at least 2 to 3 hours before bed gives the kidneys time to manage minerals and water before the body shifts into deep rest. This habit reduces nighttime fluid retention and supports smoother morning filtration. Many nephrology dietitians report that patients who switch to lighter evening meals experience less swelling, fewer nighttime cramps, and more stable morning blood pressure. Some foods should be limited at night. Processed meats, canned soups, and salty snacks contain high sodium and phosphorus additives that place heavy strain on kidney filters. Late-night desserts that contain added sugar can push blood sugar up quickly. The kidneys must then work harder to restore balance, which adds stress during the night. Kidney-friendly evening additions can support healthier filtration. Blueberries and cranberries contain natural plant compounds that benefit the urinary tract. Winter pears provide hydration without a heavy mineral load. A small portion of unsalted almonds or oats helps stabilize blood sugar through the night and reduces kidney stress during sleep. This simple evening habit works quietly but powerfully. It lowers pressure, improves morning hydration, and reduces the burden on kidney filters. This makes it easier for creatinine levels to stay in a healthier range. Let's pull everything together into a quick checklist you can act on immediately. So here is a quick recap of the video. Morning facial puffiness shows early fluid imbalance from slowed filtration. Muscle cramping and twitching point to shifts in minerals that increase kidney strain. Midday fatigue appears when hormone signals weaken and oxygen drops. Dry and itchy skin starts when phosphorus builds and moisture falls. Urine changes show color, odor, and foam that point to filtration issues. Blood pressure swings show unstable water and sodium control. And the evening kidney-friendly meal habit helps reduce overnight strain by lowering sodium load, controlling protein, and supporting gentle hydration through the night. If this video helped you understand your creatinine better, do not leave without subscribing to Knowhow. And if you feel this content spoke to your problem and gave real support, type relief in the comments. I would love to know it helped you.